Another potential utility of liquid biopsies is to assess resistance. Yeah, nowadays you have the patient with EGFR, for example, no? You have patient EGFR, you give a standard of care, osimertinib, and that standard of care is even changing now. We are doing osimertinib plus chemo, osimertinib plus amivantamab. But anyway, you give therapy for EGFR, and then one day the patient, the therapy fails. Progression-free survival of osimertinib is 18 months, and the patient develops new genetic aberrations, sometimes, for example, MET amplification, HER2 mutation, or sometimes the patient inside the EGFR develops new mutations like 797, 721, 724, 718. If we do not learn this information about these genetic aberrations, we will not take an opportunity to use more target therapy to fight this disease. And we will put the patient empirically on palliative chemotherapy that will only give him 1 or 2 years of survival. So that's why it's very important to we still have the opportunity to tailor therapy and do precision medicine. When the patient with EGFR, ALK, ROS fails treatment, we can do an NGS again and trying to find what is the new genetic aberration that is causing the trouble. Hopefully we can give them tailored therapy or put him in a clinical trial, and we can buy more time before to embark in a palliative chemo that gives a limited survival. This retesting or this repetition of the original molecular testing is easier to be done with liquid biopsy, because if the patient has had progressional disease in the brain, the patient has had progressional disease in a difficult area in the lung sometimes, or the patient doesn't want to repeat a biopsy of progression, a blood draw can be the solution. That is why for assessing of resistance, the third indication, liquid biopsy can be very useful. Yeah, a lot of us still advocate repeating a biopsy, but I understand sometimes to repeat a lung cancer biopsy is not easy. For example, I also have a lot of patients with emphysema, very senior people. You don't want them to have a pneumothorax, it's risky. That's why the liquid biopsy, to assess tumor resistance, it becomes a very important indication that is not standard of care yet, but very, very important to be implemented as soon as possible.